Hi, my name is Pam Martin, and I am a BSN student at Southern New Hampshire University, Nursing 325. This is my video of my physical assessment, and I will start by showing you the room we will be performing the assessment in. Here's everything. There's my table with all my supplies, and this is the room. Okay, and this young lady is my volunteer. Can you tell us your initials and your date of birth?
HM 08/29/1995.
Thank you. And do you consent to being taped while we perform this examination?
Yes.
Okay, thank you very much. All right, so to start this examination, if we were in a hospital room or a clinic, I would close the curtain, I would close the door to provide privacy, and perform hand hygiene. I will use my sanitize those hands wipes. Okay, and our assessment will begin with hair, skin, and nails. Okay, so here's my subject. I'm going to take a look at her skin. It's warm and dry, soft. She does have a small mole right here on her right arm. Left arm the same, warm, dry, soft. Let's take a look at her neck. Well, she does have a rash in the front of her neck and in the back of her neck. Okay, can I see your fingernails? Her nails are not thick or brittle. I don't see any irregularities. Okay, so can I take a look at your legs and your toes? The skin on her legs is soft, dry, and warm. No thickness or irregularities with her right foot and toenails. Her left foot, leg, skin is soft, warm, dry. No irregularities. Good skin turgor, bounces back. I'm going to feel her head, symmetrical, no irregularities. Her hair is soft, it's not coarse. I don't see any infestation. It is distributed evenly, no bald spots or hair loss. Okay, so now we're going to examine your head, your neck, your ears, your nose, your throat, and your eyes. Okay, so first thing I'm going to do is feel your neck. I don't feel any lumps, it's symmetrical. Okay, next I will check your eyes. I'm going to take a look at them. Okay, all right. They're bright, the sclera are white and shiny, irises are brown green, the pupils are even, about 3 millimeters. Okay, look at your eyelids. They look fine, no swelling or drainage. The conjunctiva is pink, no swelling, no drainage. I'm going to feel her temporal artery. You've got a nice even pulses there. I'm going to auscultate, listen for bruising. I'll auscultate with the bell of my stethoscope. No bruising. Okay, I'm going to check her carotid arteries. And a nice steady pulse there. Steady pulse there. Okay, I'm going to listen with the bell of my stethoscope. Okay. Okay. Now I'm going to check her maxillary sinuses and press down. Any pain?
Nope.
And her frontal sinuses, any pain?
Nope.
Okay. I'm going to check her thyroid from behind. Okay. It feels normal sized, no swelling or hardness. Okay, now I'm going to check your peripheral vision, okay? So I want you to cover your right eye with your right hand and tell me, and look straight ahead and tell me when you see my finger.
I see it.
Okay. Now cover your left eye with your left hand. Tell me when you see my finger.
I see it.
Okay. All right. And I would test your vision with a Snelling chart, but we don't have one of those. But if we did, the chart would be like the chart you see at the eye doctor's with all the letters. It'd be 20 feet away, and there was a certain line that would say 20/20. If you could read that line without glasses on each eye by covering one eye and then the other eye, you would have 20/20 vision. Okay. I'm going to check for accommodation. Okay. I want you to look straight ahead and watch my finger. Okay. Now I'm going to check your pupillary reflexes. Can I have your phone?
Yep.
And your flashlight? Okay. All right, look straight ahead. Look at the TV, actually. Look at the TV. Okay. Open your eyes wide and stare at the TV. Okay, so now I'm going to be watching for constriction when I shine the light in her eye. Yep. Okay, left eye constricted. The right eye constricted. So her pupils are equal, round, reactive to light accommodation. Okay. All right. Now I'm going to check your jaw. Okay, your TMJ joint. Open and close. Good. Okay, I don't hear any crepitus. She's got a good yawn. I don't hear any crepitus or clicking. Okay, we'll take a look at your nose. Her nose is even, no deviated septum. Okay, I want to check to see if it's patent. I want you to take your right hand, breathe in. Okay, left, do the same. Okay, it looks like she has good patency on both nostrils. Now we're going to do a smell test, okay? Close your eyes. Take your right hand, cover your right nostril. Tell me what you smell.
Mint.
Okay, correct. Okay, now cover your right nostril with your right finger. Yep. Tell me what you smell.
Vanilla.
Okay. All right. Nose is fine. Let's check her ears. Okay, no drainage. The skin around the pinna and earlobe are healthy. Let's look at right ear. Same thing. No drainage. It looks healthy. Okay. I want you to cover your left ear with your left hand. We're going to do a whisper test.
Ball paper hat.
Okay, now let's do the other ear, the left ear.
Ball paper hat.
Okay, good, your hearing is good. We did your nose. Okay, let's check your nerves. Okay, I'm going to check your trigeminal nerve or your fifth cranial nerve. Okay, can you clench your jaw? Okay, move your jaw side to side. Good. Okay, I'm just going to check the sensation on your face, okay? All right, you tell me if it's dull or sharp.
Dull. Dull. Sharp. Dull.
Okay, that's all intact. Now check your seventh cranial nerve. Smile. Okay, frown. Okay, raise your eyebrows. Close your eyes tight. good. Okay, we'll check your reflexes, okay? Got my reflex hammer. So I'm gonna check her bicep. Okay, hold your arm out like that. Okay, we saw her reflex there. Let's check the left, the right rather. We'll hold her arm out like this. Okay. Let me check her knees, patella. Okay. Now I'm gonna check her Achilles. Don't just let it dangle. Just let it relax.
Yes.
Okay. 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 Check your reflexes. Okay. I'm going to check here are the cranial nerves. Stick your tongue out. It's got a hair in my eye. Move it side to side, up and down. Okay. You open your mouth and say ah.
Ah.
Let me get to your camera again. Your light rather. Okay. Put your tongue down. Okay. All right. Thank you. Okay. There's one more thing here. All right. Oh, your gag reflex. I'm not going to check that today, but if we were to check it, I would take a tongue depressor and put it down your mouth and make sure you had a good gag reflex. That's very important for swallowing. Okay? All right, so you did your skin, hair, nails, we did your eyes, your nerves, your nose, your throat, your ears. Time for your cardiac exam, okay?
All right.
All right. So you can stay seated if you'd like. Okay. So first, I'm going to listen to your heart, okay? I'm going to listen with the diaphragm and listen for the S1 and S2 sounds around all your heart valves, okay? And I'm going to start on your upper right with your atrial valve at the second intercostal space. I'm listening for the lub dub. Okay. Now I'm checking your pulmonic valve with your left side, the second intercostal space. And your tricuspid valve, which is the fourth intercostal space. We forgot Erb's point at the third intercostal space. And then the point of maximum impulse, which is your mitral valve at your fifth intercostal space. Okay. Now I'm going to check for murmurs around the same heart valves with the bell of my stethoscope. Okay. So go into the atrial valve, the pulmonic valve, Erb's point, tricuspid valve, and the mitral valve. Okay. I'm going to check for jugular vein distension. Okay, can you look over to the right? Okay, no JVD there. Okay, no JVD there. Okay, now I'm going to check your pulses. I've already checked your temporal pulse and your carotid pulse when I did your head exam. I'm going to check your brachial pulse on the inside of your elbow. Okay. We've got good brachial pulses. Okay. I'm going to check your radial pulses. Right over your thumb on your wrist. And your popliteal pulses, which is behind your knee. Okay. Now your other knee. Yeah. Okay. I'm going to check your posterior tibial pulse. Okay. And your dorsalis pedis pulse. Okay, your Check your popliteal pulse here on the left. Your dorsalis, your posterior tibial, your dorsalis pedis pulse. Okay. Now I'm going to have you lay down and I'm going to check your renal arteries as well as your femoral arteries and your aorta. And while you're laying down, I'm going to check for JVD again. Okay, can you look over to the wall? Okay, so no JVD on the left. Now look over to the window. No JVD on the right. Okay. Now I'm going to listen to her renal pulses with the bell of my stethoscope. I will listen to her aorta, which is above her umbilicus. And now her femoral pulses. Okay. Now we're going to check for capillary refill. Okay, can I have your hand? She's wearing nail polish, but if she didn't have nail polish on, I would be blanching her fingernails and watching for refill. If it was over 2 seconds, that would be considered slow capillary refill, and we would investigate further. Okay. All right, we'll check your toes. Good cap refill on all her toes. Okay, now I'm going to do her gastrointestinal exam. Okay, so we will first inspect, then auscultate, percuss, and lastly palpate. Okay, so her abdomen is flat. I don't see any hernia, bulges, any distension. Okay, now I'm going to auscultate the 4 quadrants of her abdomen, starting in the lower left. Lower left, sorry. Okay. And she has good bowel sounds. Now I'm going to percuss and draw an imaginary X and percuss in each quadrant, okay, with my middle finger. And it's dull here. Feeling a little bit of resonance over her liver. And now I'm going to palpate for tenderness in her liver and spleen. So her spleen feels normal. Any tenderness? Okay. Nope. And her liver is not enlarged. No tenderness there. Nope. And I don't feel any masses or lumps. Okay, here's her GI exam. Okay, we'll now do her respiratory exam. Okay,
So I stand up?
Stand up. Yep. Okay, we'll stand right here. Here. So with the respiratory exam, we are going to palpate for fremitus. Then we will percuss and then we'll auscultate. Okay, but first I'm going to inspect chest expansion. Have her take a deep breath in and out and feel for even expansion. Take a deep breath in and out. Okay, so that feels good. All right, now we're going to do palpating. We'll start up here on either side of her spine and the upper lobes of her lungs, and say 99,
99, 99, 99, 99,
Okay.
99, 99, 99, 99.
Okay. I feel good. Now I'm going to percuss the same areas. Okay, now I will auscultate. And say 99 when take a deep breath.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, good. And we'll do the same thing in the front.
All right.
Okay. So I'm going to palpate for fremitus. Okay, say 99.
99, 99, 99, 99.
Okay, now we're going to percuss. Okay, and now we're going to auscultate. 99, don't forget
Yep.
99.
99, 99, 99, 99, 99.
Okay, getting there.
All right.
All right, let's do the musculoskeletal system.
Okay.
So we'll start with the neck. Let's flex the
Okay.
neck, chin down to your chest. Okay. Put your neck back. Now I'm going to test your strength. Push forward, good. Push back, okay. Now ear to shoulder, ear to shoulder. Okay. Okay, good. Good. Now shrug. We test your shoulders. All right. Shrug. Okay. Now you're gonna flex your shoulders. Okay. I'm gonna put them all the way up. Okay. And put them down. Oh, that was. Yeah. Okay. Now we're gonna bring them forward. Okay, that's flexion and extension. Okay. Good. That's your shoulders. Now let's do your arms. Let's extend and flex and bring it down. Okay. Now we'll do your elbows. Flex, extend. Okay, pronate, supinate. Okay. We'll put your arms down. We'll do your wrists. So keep your wrist palms facing back like me. Okay, now we're gonna move your wrists out. You're gonna abduct, adduct. Okay, put your fingers, flex your fingers, open them up. Now we're gonna flex your wrists, extend them. Okay, spread your fingers. Okay, do that. Okay, now grasp my fingers. Okay. I'm gonna do your hip. We're gonna adduct your left leg, my right leg. Bring it out, bring it in. Now bring it forward like you're a rocket. Okay, bring it back, bring it back. Okay. Let's do the same with your right leg and my left. Okay, bring it out, abduct, adduct. Bring it out, flex, extend. Okay, now your knees. Bring your knee up. Okay, bring it down. Bring your knee up. Bring it down. Okay. Now you can sit. We'll do your ankles, okay?
Oh, there we go.
Okay. I want you to dorsiflex and plantar flex. That's plantar flex rather. That's dorsiflex. Dorsiflex. Yep, plantar flex. Now do it, resist. Okay. Okay, now turn them in. That's adduction. Okay, turn them out. Abduction. Okay, curl your toes. Okay, good. All right. Now we'll do some motor tests, okay?
All right.
I'm gonna have you just walk across the room normally. Okay. Now do heel to toe like this. Okay. Good. Now walk back on your tippy toes. Good. Now walk back on your heels. Okay. Now you're going to do a rapid movement. Do this real quick. Okay. All right. There was one other thing on that. Okay. All right. So now I will have you do the Romberg tests. Oh, actually, we're going to have you touch your nose. So close your eyes, put your arm out, just one arm. Choose an arm. Touch your nose. Okay. And okay. And now we'll do stereognostic test. So sit down and close your eyes. Put an object in your hand. You tell me what it is.
Key.
Yep.
Coin.
Okay. Keep your eyes closed. We're gonna go do graphesthesia. I'm gonna write in your left palm a letter. You tell me what it is.
A.
Okay.
P.
Yep. Okay. Now I'm gonna test your sharp and dull sensation on your arms and your legs. Okay? So you know what it feels like.
Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Dull.
Okay. All right. I'm going to ask you to count backwards from 100 in increments of 7.
100, 93, 86, 79, 72.
Okay. Good concentration. All right. I'm going to tell you 4 words, and then in about a minute, I'm going to ask you to recall them.
All right.
Okay? The words are ball, paper, hat, toy.
Ball, paper, hat, toy.
Okay. Now count backwards from 100.
In
Increments of 20, yeah.
all right. 100, 80, 60, 40, 20, 0.
Okay. And can you tell me those 4 words?
Ball, paper, hat, toy.
Okay. Can you remember what you did on your last birthday?
I don't think I really did anything.
Okay. All right.
Maybe went out to dinner, I'm sure.
Do you remember where we went out for dinner?
Not really.
Okay. All right. And,
I remember the birthday before.
okay.
I drove to North Adams.
Okay. All right. And can you tell me what state we're in?
Rhode Island.
Okay. Can you tell me what year it is?
2022.
And who is our president?
Joe Biden.
Okay. All right. There was one thing I forgot. Oh, I didn't do your O2 sat when we did your respiratory assessment. We're just gonna fill in the blanks, what I missed. Good, 97%.
Just changed to
Okay.
98.
Oh, okay. Oh, and I have, I want you to do, this is one more part of your mental status exam. Follow the instructions in this paper, okay? Okay, thank you. Well, that concludes our exam, Hannah. Thank you so much.
You're
And
welcome.
thank you. Bye.